welcome to Getting to Impact Community of Practice. This is a community of practice all about planning for poverty reduction. Do you want to go to the next slide? So as I mentioned, this is our newest community of practice, and it was conceived after the National Poverty Reduction Summit that took place in Ottawa this past May, which I know some of you were able to attend. And it became apparent to us that many communities were looking for help in building poverty reduction strategies or community plans. And we thought, hey, let's start a new series just on this topic where we can connect practitioners with expertise in this area who have, experience implementing plans with those who are just getting started or wanting more information about how to get a poverty reduction strategy in place. So Getting to Impact was born, and we're excited to see where it goes. So at this point in time, I'm just going to unmute our audience members, and we'll ask you to mute your lines individually in the audio setting of your go-to control panel as you're talking and when you're not, to cut down on feedback. So here we go, and I'm going to invite you name by name to introduce yourselves. If I can, here we go. All right, so I see Bonnie on the line. Bonnie, do you want to say hello and let us know what brought you to the call today? Bonnie, you're self-muted. Do you want to unmute yourself? There we go.
Okay. Can everyone hear me okay?
Yeah, perfectly.
Excellent. Okay, I'm from Thunder Bay. I work at the Lakehead Social Planning Council. I'm the social researcher and planner there. And I am the coordinator of Thunder Bay's Poverty Reduction Strategy, which has been around for about a year now. We just completed our first annual report. So we're getting to the point now where we are starting to take action to meet the goals and the recommendations in our strategy, and things are actually going very well, but always looking for input and love to hear other people's stories of their poverty reduction strategies and how things are going for them.
Thanks, Bonnie. Carissa D. Ganji, would you like to unmute yourself and let us know what brought you to the call? I see you're still muted, Carissa. Are you able to unmute yourself? Okay, we'll try Danielle. Danielle Klooster, do you want to tell us what brought you to the call?
Sure, can you hear me?
Yes, we can.
Okay. So I'm the
Hi
community...
there, so my name is Carissa DeGangi. I'm here with ABC Life Literacy Canada, and we're really interested to see the different ways in which literacy education might fit into the different poverty reduction strategies that are happening across Canada.
Thanks, Carissa. Go ahead, Danielle.
Okay. I'm the community mobilizer with the Central Alberta Poverty Reduction Alliance, and we are a collective impact initiative. And so I want to learn as much as I can about that, but also we are just embarking on a poverty reduction strategy for Central Alberta. And so the timing of this was just fortuitous for us, so that we can learn all of the best practices along the way as we go through this process.
Perfect. Thanks, Danielle. Dave Furs, do you want to introduce yourself?
Hello, I don't know if this is working.
Yes, we can hear you.
Excellent. Is the volume okay?
It's perfect.
Okay. Okay. So I'm a community development practitioner for sort of 25 years, and I've worked in local authority in the UK, but also in the voluntary sector. And currently, I act as a sort of self-employed consultant in community development, particularly focusing on the deprived areas in a county in the UK called Buckinghamshire, and it's a strange place because it's very affluent, but there's pockets of deprivation. So I'm interested in a part of the county partnership board on child and family poverty reduction. But my general interests also are in terms of measuring impact of interventions. So I'm on the board of a company called the Social Audit Network, and that's all about measuring the impact of the interventions that various civil society organisations put in place.
Wonderful. Thank you for being on the call.
Thank you.
Diana, I've just unmuted you. Do you want to say hello?
Hi, can you hear me?
Yes, we can.
Okay. Diana Souvigny here with Central Alberta Poverty Reduction Alliance, CAPRA, the same as Danielle Klooster. I'm part of the admin team, and as Danielle said, we were at the Poverty Summit and really saw a need for our local area to create a poverty reduction strategy. So this community of practice is very timely, and we look forward to learning lots as we're moving forward.
Wonderful, thank you. And now I see Fredericton is on the line. Who from Fredericton is calling in?
Hi, it's Suzanne White.
Hi, Suzanne.
So I'm here today to learn from a couple of experts whom I really respect and live in St. John, New Brunswick.
Aha, Cathy and Barry, yes, local celeb.
That would be who it is.
Perfect. Heather Dukes, do you want to go ahead and let us know what brought you to the call? Oh, Heather, sorry. Can you, do you want to try speaking now? I've just unmuted you. Okay, I think we'll have to skip past Heather for now. Heather, if you want to just type your update into me, I'm happy to read that out loud. We'll just go on to Janice Dunbar. Janice, are you able to, are you connected with a mic, Janice? Or maybe we're, oh, I can hear your typing, Janice, actually. Do you want to say hello?
Hello, how are you?
We can hear you, Janice.
Oh, you can? Okay,
We can.
I didn't think the mic would work. It's Janice Dunbar. I'm calling in from Huron County, the Poverty to Prosperity group here.
Perfect. And Heather did type in her update. So Heather Dukes is joining us as well. She's a BSW student at Algoma University in Sault Ste. Marie, and she's doing her practicum on poverty reduction strategies for the Algoma district. Welcome, Janice, and welcome, Heather. Lynn Smith, would you like to go ahead and introduce yourself?
Hi, everybody. I don't know if you can hear me.
Yes, we
can.
can.
You hear me? Can you hear me?
Yes, loud and clear.
Good. Okay, so I too went to the Poverty Summit in Ottawa and also the Living Wage Gathering the day before. I'm the coordinator and only staff member of the Child Poverty Action Network here, so sort of have multi-hats on all the time, but really interested in poverty reduction and elimination. In fact, we're in the process of trying to organize a local poverty reduction forum in September, and myself and a lovely lady called Mary Lou, who's a social determinants of health nurse from Halliburton, were on a provincial webinar for HT Link not too long ago about poverty reduction, and they've sort of started doing that in Halliburton, so we want to see what they're doing and if we can save ourselves reinventing the wheel, and so this is really timely for us too.
Oh, perfect. Wonderful to hear. Nancy Fisher, would you like to go ahead and say hello?
Hi, I'm Nancy Fisher from City of Peterborough, and I also attended the Poverty Summit, and we've had a lot of poverty work going on in the community, but I'm work for the municipality, and I'm really interested in how the municipal role fits into all of this. We're doing some more work that way, and so I'd like to learn from those with experience on that.
Perfect. Well, it's the call to be on for sure. Terry Lynn Carter, would you like to say hello?
Oh, hello. Can you hear me?
Yes, we can.
Oh, hi, everyone. I'm the coordinator for Thunder Bay Counts. It's a collective impact, and we're looking at different goals, and one of them is a community free from the effects of poverty. And I also sit on the poverty reduction strategy in Thunder Bay.
Perfect. Hello. The last person I think I see on the line is David Sandoz. And David, I don't think for some reason I'm unable to mute you. If you want to just write your check-in or your hello to us, I'm happy to read that out, David. Is there anyone else on the line that that hasn't said hello yet that would like to? or please feel free to type your update into the question box. So David's from Alberta Human Services. Welcome, David. Perfect. Okay, so with our updates, welcome everyone to the call. So wonderful to hear from all of you and where you're calling in from, and what brought you to the call. I'll jump in right into introducing our speakers next. Natasha, if you want to click to the next slide, that would be great. So here we have Bhavana Varma. She is going to be our first presenter. She's the CEO and president of the United Way of Kingston, Frontenac and Lennox-Addington. And she'll be sharing highlights from the Kingston Poverty Reduction Plan today. And then we'll be hearing from Cathy Wright, who's the Executive Director of Living SJ, and her colleague Barry Galloway, who's the Community Consultant for Living SJ, about their new social renewal strategy. And you will have all hopefully received links to these respective plans in the email that you actually registered to attend this webinar. But we'll make sure that we send the links to these plans out again in a follow-up email after this call to make sure you still have access to those. So with no further ado, Bhavana, I'll welcome you to get your presentation started. And I need to unmute you. There you are, Bhavana. Now we should be able to hear you.
Okay. So thank you, everyone, for taking the time. It sounds like we've got a lot of experience around the table, so I'm interested in your questions at the end because that always helps us rethink some of the things we're doing. So because this is about collective impact, I started with talking about the poverty reduction initiative that we've got going. But I've also added a piece on the youth homelessness because some of the lessons we learned from the poverty reduction we're actually able to do follow a smoother process with the youth homelessness. So our poverty reduction initiative started a long time ago. The mayor had a task force on poverty that then created a poverty roundtable, and we found that the poverty roundtable wasn't getting a lot of traction. So the municipal government, the city council, the CAO, and the United Way kind of worked together to see what we could do to take it the next step. And the Poverty Roundtable also had a 5-year sunset clause, so we had to work on making sure we captured the great work that they had done as a foundation. So the city, the United Way, and the Poverty Roundtable had representatives around the table, and we tried to look at what we needed to do. And one of the things with collective impact is that everyone has probably experienced is that it's very challenging because we all have different cultures, different methodologies, different philosophies about how to approach the same thing. And for us, one of our volunteers said that we're all driving different cars, but we're headed in the same direction. So every time we kind of came to an impasse, we reminded ourselves that we were headed in the same direction, and we had to take the time to have the conversation to work through our different approaches and philosophies and theories. It was time-consuming, and as anyone has ever mentioned to you, and that's what the advice I got, if you think it's going to take X amount of time, just double it or triple it because it'll take that much more. And I found that was true. I didn't believe it because I'm always an impatient person. I started off thinking we'd get it done really quickly, like we got all this experience from all the other communities, so we knew what we had to do. And we really had to slow ourselves down, stop, and allow the conversations to happen time and time again so that we could move forward collectively. And that, I think, is something that most of you have probably experienced in your own communities. Or if you haven't, I'd be interested in hearing about any that didn't. Like with all of you, we had a lot of community conversations around the issue from very diverse groups. We really worked hard to get people with lived experience to share their stories, share their experience, and tell us what we needed to do differently. With the youth homelessness, it was a little easier because it's an issue that there isn't a lot of work done. So while it takes a lot more thought to develop a process, it was actually easier in some ways because there wasn't a pre-established, people didn't have pre-established ideas of how we should go about it. So we were selected as part of a national pilot. Kamloops and Kingston were the two mid-sized communities selected for mobilizing local capacity to end youth homelessness. And so we recruited a steering committee and the youth planning committee, and the one that we had, and with any collective impact, the one that's most valuable are the voices of those who are impacted the most. And in this case, the youth were absolutely wonderful. Their courage, their resiliency in very difficult circumstances certainly helped frame our actions. So we're in the implementation phase with that. So Natasha, if you could get the next slide, please. Natasha, the next slide, please. So I'm going to skip through this a bit just because it's just to show you the common piece. Who we selected, we needed some backbone coordinators. So with the poverty reduction, because we had so many different groups, we had 3 backbone organizations to facilitate the conversations. With the youth homelessness, we have 1 steering committee, and in some ways it's easier because we have everyone at the same table having the same conversations. So then we'll go to the next one. With the poverty reduction, and I'm sure these are very familiar to most of you, through our community conversations, the issues that came up, which wasn't really a surprise to most people, was housing, skills development and employment, community supports for education, social service and community supports, and health. And it was difficult for us in some ways that we had to constantly remind ourselves that we were not reinventing what people were already doing, that this was not about changing the education system at this point. It was what we could do as a community to either influence or share things, but really looking externally at what we could do to support the education system, for example. We weren't going to change the hospital necessarily. It was more a practical approach to what can we do else outside of the hospitals and healthcare to look at what we could do to help that. And again, we ensure that people with lived experience were part of every group. As many of you have learned, we didn't want token representation, so we tried to make sure we had, and the number we came up with, what we heard from people was at least 3 people who had lived experience, and it wasn't actually past lived experience, it needed to be current living experience, the experience. So Natasha, the next one. Next slide, please. So these are just some of the areas we focused. And if you look at our report, this explains in more detail what we picked in all of this. So I see that I mistyped one of them. So in the report, you'll see the actual ones for skills development and employment. So I'll just continue to the next one. Actually, if we could skip over the next 2 slides. Yeah. So then what we found with, just back one, please. Sorry. What we found with our poverty reduction was having 5 working groups. We did this for 2 years, and every year we tried to capture, and we learned this from Tamarack actually, we tried to capture not just what was going to move the needle, but what was happening every day, the little successes, the things that people had done, the conversations we'd had. So we tried to capture them, and we created reports that were people-friendly, so anyone could pick it up and actually just glance through it and get a sense of what was happening. But we did find it very challenging to work on 5 different issues at the same time because we started to bump into each other. We started to have the same conversations at different tables. So we actually are now focusing on 2 areas, child poverty and employment and skills development. Within those working groups, at one point, there's always that point of complete chaos where all these ideas are up in the air, and it's challenging at times to see light at the end of the tunnel. But our groups are very good at reminding themselves that at the end of the day we needed to have some action to show momentum. So each of them picked 3 things they would do differently or they would focus on, and we kind of focused the last year and a half, we focused on actually doing something in those. So again, our 2014 report, which has been sent to you, actually has a lot of that outlined on what we actually did as successes. And they were small successes. Some of them were big ones. Some of them were shifts in thinking. Some of them were influencing how our municipal government thinks, how our funders think, how people think about the issue. As Dave mentioned, in the UK, in Buckinghamshire, similarly in Kingston, we have a very affluent group, but we also have pockets of tremendous poverty. So it was reminding people that this is actually not something for another community. This is happening right here, and here's what we can do about it. We were very cautious how we approached the private sector because the experience with the roundtable had been bringing them in too early. They get impatient because they want to tell you exactly what they want to see right away, and we weren't in a position to do that. So now, towards the end of the year, we started to bring them in and have them participate much more. And so we got a little better at being very targeted in what we ask of them. Next slide, please. In youth homelessness, it was simpler, as I said. So we picked 3 goals. Again, this was based on our conversation with youth, who told us that the 3 things that caused them to be homeless were family conflict, mental health and addictions, whether it was their own or the people they were living with, and the final one was, of course, education and skills development. So we took that and then we put it over a framework to see what we needed to do differently, and from community forums, youth forums, a lot of discussion at the steering committee and other tables, we came up with these 3 areas. And again, the report outlines this in much more detail. Next slide, please. This is the structure we have currently. We believe that if our theory of change is if we focus on awareness and universal prevention, it will reduce the number of targeted prevention and intervention that we need to do. And so in the intervention, we currently have a number of youth who we're supporting. We're trying to get to them even earlier, so we're looking at starting from grade 7 and 8 and then work up. And of course, recognizing that the housing options for youth are not necessarily the same as the housing options for adults. And so we're working on that as well. So I think I'll end at that, unless anyone has any questions.
I think we'll just leave the questions all to the end of the presentation.
Oh, sorry, yes.
Bhavana, and yeah, so thank you so much for the presentation, and we'll jump right into the Living SJ presentation from Cathy and Barry, and take the questions at the end. Thank you.
Okay. Hi, everyone. It's Cathy right here and my colleague Barry. And just for the record, we're not experts, Suzanne. We'll get later. So what we wanted to do is talk about why we have Living SJ and how we moved from vibrant communities to Living SJ and the legacy that continues beyond. We also want to talk a little bit about our priorities and the process to getting to those priorities. And we want to interweave that throughout with what we've learned to date in both thinking about how we're doing and actually what we're trying to do differently. And I'll turn it over to we want to move to the next slide.
So Natasha, if you could bring us on to the next, thank you. So again, my name is Barry, and I'm just going to give the evolution of
Barry,
yes.
It's Kirsty. Sorry, I'm just interjecting. I'm hearing a bit of feedback from your end. You might just want to adjust where you're speaking into your microphone.
I'm pretty close. How's this?
Okay, sounds better. Thank you.
Any better? Okay.
Yes.
So just a history of poverty reduction in St. John. Back in about 2003, our community really came together. We saw stats at that time through Stats Canada that were quite daunting for our community. The levels of poverty had really exceeded anyone's expectations, and the community came together and realized something had to be done. A number of community partners came together, the business community certainly. We have a strong business community here focused on poverty reduction, the Business Community Anti-Poverty Initiative. We had a number of nonprofit groups come together. For example, the Urban Core Support Network, now called the St. John Women's Empowerment Network, supporting women who are living in poverty. And certainly the City of St. John was a huge partner in this as well as the Human Development Council, which is our social planning council in St. John. And together, they connected with the McConnell Foundation at the national level and were able to leverage some resources to help us really form a strategy as we move forward. By 2005, we had done a significant amount of work in our community. We had produced our first document called Poverty and Plenty, and honestly, that was a turning point for the community, because what we were able to learn by really assessing the stats that were coming out of our community was that over 60% of the poverty in St. John existed in 5 neighborhoods. And we knew at that time that this meant we really needed to focus our resources in those neighborhoods if we want to create significant change. So by 2005, we had established a leadership roundtable and we had identified priorities. And the leadership roundtable was comprised certainly of the business community, nonprofit groups, local government, and resident leaders from our neighborhoods. We really have focused heavily on revitalization of those priority areas in St. John. This work continued in our community. We identified a number of priorities at the time. One was neighborhood revitalization and housing. We really wanted to focus on children and youth, and in particular early learning initiatives. At the time, things were evolving like PALS, which is a great resource to our schools and our community, where the business community has been matched mentors with kids in schools. This has evolved immensely over the years, and we really focused on workforce as well. By 2012, we'd seen a reduction in poverty in our community, said around 20%. It was actually 18.6% in 2012 we were down to. And the poverty rate for children still remained quite high, and we actually are tied with Toronto for the highest poverty rate for children in the country. Not something we're particularly proud of. In 2014, senior leaders from our community really came together and we said, okay, we've been doing this for about 10 years now. We really have focused our efforts and we've made some significant improvements in our community. However, we know also that, you know, when you develop a strategy, after about 10 years, it's time to renew. It's time to really pull the community together again and start to garner that kind of momentum to move us forward. And through that process, we evolved Vibrant Community St. John into a new entity for our community, Living SJ. And that's the new steward of the poverty reduction efforts for our community. If you want to turn to the next slide.
So one of the things that we realized is that we also needed a new approach if we were going to try to have greater impact. And as Barry said, we're really building on a foundation of 10 years of poverty reduction work. So what did we have to do differently? We looked at a number of communities, particularly in the States, where really collective impact was quite big, and thought, okay, we know we want community ownership to the challenges that we face. So we adopted a framework of collective impact. And what that has done is, it has guided us on having a common agenda. So we knew that a small number of priorities that are very focused. In terms of shared measurement, each priority had to have a target, and a target that actually sort of brought us all together. We also realized that we had to have continue to build all four sectors, having an ownership to this, but to try to at the same time break down some of the silos that not only exist between different government departments, but between the community and government departments. And of course, trying to think through how we were going to and are going to communicate internally with all of our growing stakeholders, as well as externally with people that have been involved in leading community efforts over the past 10 years. We actually kicked off our strategy in December of this past year. And then the backbone, well, we'll talk a little bit more about the backbone and the number of different components that relate to the backbone piece. Next slide, please. So really, just in a nutshell, Living SJ is a vision of the community working together differently to improve the quality of life for all citizens. And the primary focus is on individuals and families that have the least opportunities and the least access to resources. It's a 5-year strategy. Hopefully, as Bhavana talked about, it's our sunset clause, but we'll see if we can get there. Okay, next slide.
Next slide. Thank you. So as Cathy said, one of the key things that we wanted to see happen was to redefine the leadership for our community. We had a strong leadership roundtable with Vibrant Community St. John, but we also recognized that if we want to create the kind of change that's needed in our community, we needed to raise the bar a little at our leadership level. So right now, we've established senior level regional directors within government government, senior level business leaders, really the decision makers in our community are really highly invested and part of our leadership team for Living SJ. So we have absolutely got resident leadership there, we've absolutely got community leadership, but if we want to see the kind of changes and policy implications changed as we move forward, then we have to have high-level leadership guiding our efforts. Now, we also have in place a planning team, more of a backbone support for our leaders, and that's at the executive director level for our communities. So again, nonprofit groups, government representatives, we're all working together from the municipality, from the province, and from our community. We're working together to support our leadership team. So that's a significant piece of work for us. In addition, we have another group that is comprised of our community organizations. We call it the Cathy, Community Action Team, and that group. So it's really interesting how we've come together. We've established these different groups, but they're all feeding into the Living SJ strategy. And because there are so many groups, so many people invested in this process, it's really enabled us to leverage a great deal of momentum in our community and excitement. Next slide. So in order for us to identify our priorities, what we needed to do was come up with a common agenda for our community. So that meant we needed to do a lot of research up front. So we spent a year, a little better than a year, certainly looking at all of the documents that reports have been produced in our community. We looked at the research that existed, and we came up with 472 critical needs, 62 issue areas, but ultimately we came down to 4 priorities for our community. Oh, so the next slide, and those 4 priorities are really focusing on transforming low-income neighborhoods into vibrant mixed-income neighborhoods, a focus on employment and creating, opportunities for people to connect with employment and further education, focus on education and closing the education achievement gap, and a focus on health and improving access to access of residents through neighborhood-based models of care. So essentially, we're looking at developing community health centers that would exist in each community to support the needs of low-income residents. Next slide, please.
So just just to highlight what Barry has said here, so we have a governance structure in our leadership team we talked about. The collective impact teams are the teams that are leading priorities, and all the co-chairs have come from the leadership team, and we, like a couple of them, are trying to combine both, residents living in poverty leadership with business leadership, with government leadership, and nonprofit. So for some of them, they're a combination of all 4 or a combination of 2 of the sectors. We have a small staff. In addition to the 2 that we have here, we have a community consultant, which is actually Barry's position. The host agency is an interesting one. We just confirmed that our economic development agency, which is called Enterprise St. John, is going to be our host agency, because there's a real synergy between our workforce priority and the work of an economic development strategy. And we hope that this will actually strengthen the synergy between the 2. And it's all part of collective impact of thinking differently. And then the last piece on our chart is a planning team, which Barry has talked about, and they meet every other week. Next slide, please. Okay, so just really briefly, work's has been done on our 4 priorities, and I think what I might do is just look at the wellness as an example. One of the things is that with collective impact is to try to do things differently and not jump in programs right away as a solution, but also to challenge ourselves to think differently. And so we've got the St. John North, one of our low-income areas of the city, is going to be a bit of a pilot to try to do something different in that area. And so that's where we're going to try to set up our first wellness center. Excuse me. But the center, it's trying to take it out of just being seen as a health center with primary health care providers to being something that involves other government departments, community organizations, neighborhoods. So trying to get us to really think differently, and that perhaps some of the positions can actually be non-health related positions. Next slide. So in summary, we have a broad backbone. So we've got funding from actually 13 different partners, which is good. And then for all of you in nonprofit, it's also challenging. A small staff, the planning team, our host agency. We're a member, together with Suzanne, who's on the call, with a provincial network of community inclusion networks that are part of the provincial poverty reduction strategy. And of course, we're a member of Cities Reducing Poverty. So our action, this all supports our action at the local, provincial, and national level. And now that's the end of our presentation. Thanks.
Thank you.
Thank you. Thank you to Bhavana and Cathy and Barry for those really wonderful high-level details from your plans and kind of the processes that have taken place and where you're at now. I'd like to invite people just to dive right into questions for our speakers. I think the best way to facilitate this might be just if you have a question and you are hooked up with a mic, if you can just use the raise your hand function in your GoTo control panel. I will unmute you one at a time by name and just call on you to ask your question. And if you are not connected by mic, then I would invite you to alternatively type your question into the chat box, and I'll read that out loud for you for our speakers. So I see a first question here from Lynn. Lynn, I'm just going to unmute you now. Please go ahead. Let us know who your question is for and let us know what it is.
Hi, my question is for our last presenters, and it's actually sort of 3 questions in one. So I wondered how they got the buy-in from the municipalities and those people that were the leaders, the leadership group, because that's our next challenge, is to try and get the buy-in from our municipal leaders. The second part of the question is I wondered who their community action team were, and you know, were these all volunteers with only a few people that are actually employed in the poverty reduction sort of work that they're providing, and the third one was the research. Who was that done by? And I know you said it took quite a long while, but was that funded by somebody and run by university or whatever? So I probably have lots more questions, but I thought it was fascinating.
Well, maybe just to be real brief here, I think that for getting the city and community leaders, it was 2 things. Part of it is it's happened over a 10-year period, so it takes the time. But we did, as Barry had talked earlier, the city was brought in right at the very beginning when we had the opportunity from Vibrant Communities Canada, and so they had an ownership right from the beginning. And in addition, the city, about a couple of years into it, after we'd had the research that showed that the neighborhoods were a real priority for a low-income population, the city decided to set up a neighborhood stimulation fund. In the past, we've tried a lot of, supporting neighborhoods, getting neighborhood organizations, but no sustainable funding. So they made that commitment, and then they got a lot of momentum from other partners for making and keeping that commitment. Now we're just revisiting it, but I think it looks like we surpassed, because as a collective impact, we really worked together on it. I think there's really a commitment from the city to continue to do that. We actually, when we started with Vibrant Communities, one of the conditions was that you had to have all 4 sectors at the table. When we decided in 2012 to strengthen our impact, we knew we needed, as we said earlier, their more senior level leadership. Before we went any further, we actually brought those leaders together to say, you know, we think we need more impact, we need a different approach, we need to revisit our strategy. Are you in? And so there was real buy-in from that, and then from that we formed the new Living SJ leadership team. When we really thought about trying to do something differently, and that was a 2012 piece where we had vibrant communities, we brought together, you know, Community Foundation, United Way, Vibrant Community Social Planning Council, the city and province at a staff level, and together we came up with needing to do this to get differently. So a lot of it is really people finding that part of their jobs included looking at working together on a poverty reduction strategy.
Perfect, thank you.
Lovely. Danielle, I see that you have a question. Please go right ahead.
Okay, so I'm really interested in how you connected to your economic developers. We find that we know why economic development should be involved in poverty reduction, but it's hard to get the buy-in from them because where's the win for them? Like, what's in it for economic development that would be a compelling case for them as to why they should be involved?
It's a really good question, but you know, when we first started, I remember, I still very much have in my mind, there was a one-liner in there about poverty reduction being important with our economic development agency. And so I think part of it is time, it takes relationships. We're at a high rate now for a couple of reasons. One is because our co-chair, one of our co-chairs, is on the Business Community Anti-Poverty Initiative that Barry talked about, and that group hosted Vibrant Communities for 10 years, so a huge commitment there. But our co-chair is actually on the executive of the Economic Development Agency, and I think there's been a lot of relationship building over those 10 years where there was more of a recognition about, particularly from the workforce angle, do we have a trained workforce that will meet the needs of employers, and what it actually costs employers to really, keep rehiring. So I think there are a number of areas like that that help to build the relationship and the synergy over that period of time.
Great, thank you.
If I could add to that as well, I just think our community, and because of the investment from the Cathy of time and resources, and they are all business leaders, in our community, and are connected and really focused on profit. I mean, that's what business is all about. But they also had a recognition, because they certainly use evidence to guide their decision making, that if we can change the futures of people living in poverty in our community, it will turn New Brunswick around, because we have just all of this untapped resource in our community, and this is a way for us to address shortfalls in the workforce, to really focus on investing in the education, the learning capacity of residents of New Brunswick, and I think the business community is heavily behind that.
That's wonderful. I don't see any other questions right now. Any hands raised? Please do raise your hand in the control panel if you would like to be unmuted to ask your question, or type it into the box. I just had a quick question for Cathy and Barry as well, just in regards to the process that you use to narrow your 472 needs into the 62 issue areas and then the 4 priorities. What process did you use to get to that point?
Well, first, when we did the consultation, the engagement, we actually had a couple things. We had background papers on 12 issue areas. Somebody asked me about the research. We actually have research, a researcher on staff of Vibrant that we were able to really put like 8 months of that person's time into doing those background papers. But then when we did the focus group, we used a Lean Six Sigma approach, which is to getting people to focus on what are the priorities. And then once we had all the information in front of us, it was a process of continuing to kind of eliminate, find the common themes. We just kept bringing it down, and then going back to our planning team as staff to say, okay, here we are, what do you think? And we just kept looking at a way of narrowing down and finding the commonalities and looking at what were the focuses. So we actually have the four categories. For example, close the education achievement gap, but within that one we have 5 desired results. So that allowed us to still continue to have a focus, but have priorities within that focus.
Okay. Just the audio was going in and out a little bit there. Can you just repeat again who did the research?
Okay, so at Vibrant Communities, we had a short-term contract to someone, and we had funding from the provincial government. I mean, we were fortunate in New Brunswick because we were seen as really a demonstration for what communities can do for the issue of poverty. So we were able to have access some resources. So that person was able to do background papers following a format to look at root causes, common themes, what currently is going on in 12 issue areas. And that formed the backdrop for the focus groups, then using a very objective Lean Six Sigma approach to do it. And then after we had all the focus groups, we came down with each focus group had, so there were 12 issue areas, and each group had 6 issues that were the priorities, and then we just narrowed those down to common, fitting them into 4 overall priority areas, and then 18 desired results within those 4 areas.
Okay, thank you.
The website, I certainly encourage people to go to the website too.
Yes, we'll include links to those in our email as well after the call. That's great. We have a question here from David. He's saying, to all of our presenters, what are your approaches to addressing Aboriginal communities in terms of inclusion, for example, since we hear that many Aboriginal folks are, in quotations, not equipped to live in the city due to living on reserves. He's heard some of these words from Aboriginal leaders. Bhavana, do you want to maybe take the first response?
Sure. So Kingston's kind of a strange community because we have, either because of the institutions, the federal institutions, the penitentiaries, or because of the healthcare system, we do not have one nation, one group here. So we have a very diverse group. So even amongst the Indigenous people in Kingston, they're very diverse. We have a number of leaders who work very closely with Royal Military College, the government, corrections, and healthcare. So we usually work with them so that we can better engage the group. Ours, unfortunately, is not a typical community because they're so disparate. They're not one group that we can work with. But again, just bringing them to the table and making sure we hear their voices amongst the others. And many of them have not identified either, so unless they've self-identified, it's hard for us to reach out to them.
And from St. John perspective, we don't have a really large Aboriginal contingent sort of accessing services in our community. However, I mean, Suzanne is on the phone. I think she works more with the Aboriginal communities. In New Brunswick, we have 12 regions of the province. So depending on what region you're in, there's more or less connection with the Aboriginal communities. However, the United Way, who is one of our partners, one of the key partners in our work, has established an agreement to work with First Nations community here in just outside of St. John. And Cathy, I think you wanted to add something?
Yes, and correct me if I'm wrong, Suzanne, but that I think that there have been separate efforts within the Aboriginal community to do poverty reduction strategy. I know there was separate consultation. Suzanne, can you talk any more about that?
Actually, the First Nations communities in New Brunswick developed their own plan for addressing poverty. So they've taken the lead on crafting what is appropriate for them from their perspective. From a more local frame of reference, I've been working with nearby First Nations communities, and really the progress speaks from building those relationships, focusing on specific areas that they would like to target, and again having them take the lead in what direction we go in.
Great. Thanks for your reflection, Suzanne, your input. If anyone else would like to comment on this question, I'm happy to open your line. Just raise your hand and I'll open your line. Otherwise, I think we have, maybe it's time to wrap up now looking at the clock, just about 5 minutes left. So I'd like to take this opportunity just to say thank you so much to our speakers, to Bhavana and Cathy and Barry. We really appreciate you sharing your expertise with us today. I think it was a good first call. So, and thanks to everyone who was able to join and take part in the questions and listen into presentations. We'll make sure you get links to the plans and to this slideshow in a follow-up email by the end of this week. And we welcome your feedback as well on just how the call went. We'd love to know how we can make this work for you, this community practice is for you. So we welcome you to email us at tamarack@tamarackcommunity.ca with your thoughts and maybe suggestions for who we might invite to a future call or questions we can address. And our next Getting to Impact call is scheduled for July 21st. And David, this might be of note to, of interest to you, but in particular. But Amanda Enns and Roy Bear-Chief from Vibrant Communities Calgary and Julie Green from No Place for Poverty in the Northwest Territories will be sharing their poverty reduction plans and particularly sharing how they engage local First Nations and Inuit groups in the making of those strategies. So do hope that the rest of you will also be able to join us for that call. We'll send a link to register for that in our follow-up. And I think that brings us to a close. Again, please feel free to email us and enjoy the rest of your day.